Bismillahirrahmanirrahim. Quote of the day: a little progress each day add up to a big result. Today I will present SWOT analysis of health information system under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is introduction about health management information system, SWOT analysis, 7 rules for SWOT analysis, uses of SWOT analysis, recent updates, and at the end there is an MCQ session. In the end of this presentation, participants would be able to describe SWOT analysis in health management information system, recent updates, and MCQs. Now, what is health management information system? Health management information system are one of the 6 building blocks essential for health system strengthening. HMIS is a data collection system specifically designed to support planning, management, and decision making in health facilities and organization. There are different domains which are covered by health management information system, but nowadays health management information system is concerned about effectiveness, relevance, sustainability, unexpected results, cause-effect relationship, validity of design, alternative strategies, and efficiency. And I will cover the SWOT analysis of health management information system. Basically, SWOT analysis or a SWOT matrix is a strategic planning and strategic management technique used to help a person or organization identify their strength, weakness, opportunities, and threat related to healthcare competition or project planning. It is sometimes called situational assessment or situational analysis. This technique is designed for use in the preliminary stages of decision-making progress and can be used as a tool for evaluation of the strategic position of organization of many kinds, profit enterprises, local and national government NGOs. It is intended to identify the internal and external factors that are favorable and unfavorable to achieving the objective of the venture or project. Users of SWOT analysis often ask and answer questions to generate meaningful information for each category to make the tool useful and identify their competitive advantages. Basically, there are 4 things that are analyzed in the SWOT analysis. Number 1 is strength, then weakness, and then comes the opportunities and threat. Strengths of any organization, any health management information system, or any system based on some qualities, and that are a new or innovative services, capabilities or cost advantages, cultural connection, extraordinary reputation, other aspects that add value, special expertise or experience, superior location or geographic advantages, unique value that drive your health management information system. Now comes the weakness. Absence of proper planning, damaged reputation, gaps in capabilities or service area, lagging in technology, management or staff problem, known vulnerability, poor location or geographic barriers, and undifferentiated service lines. Now, what's the opportunities that deal in SWOT analysis? It might be a market vacant by a competitor, availability of new technology, changes in population profile or need, competitor vulnerabilities, lack of dominant competition, new healthcare segments that offer improved profit. Now, what's the threats in SWOT analysis of any organization, any health management system, or any healthcare setup? A competitor has an innovative product or services, a new competitor in the health sector, adverse changes in reimbursement or regulation policies, changing in the insurance plan or contract for major area employers. Competitor have superior access to channels of distribution. Economic shift, loss of key staff or associates, new or increased competition, seasonality, and shift in market demand or referral sources. So basically, these are the SWOT analysis in the health system. As for strength, think your medical business does well, qualities that differentiate you, internal sources such as skilled staff, intangible assets such as brand loyalty followers, and weakness, things your business lack, things your competition do better, resource limitation, unclear unique selling proposition, or lack of an established brand. In the opportunities, undeserved markets for specific services, few competitors in your area, emerging need for service line, press media coverage of your practice, and the threat is rising competitor, changing regulatory environment, negative press or media coverage, changing patient attitude towards your practice. Hospital SWOT analysis example. Establish brand in the market, support by in the management, strong presence in communities, and strong funding, partnership with public health. High nurses turnover rate, competition between hospital clinics limit efforts to some degree, staff participant limitation, bureaucracy and the need for brand culture, bread and partnership relationship, constant message in programs, technology upgrade, establishing great brand reputation, sudden in healthcare orient to our organization, increase and branding effort, and the threats are internal misalignment, lack of shared strategic vision, decisions are disconnected, patient experience challenges that come with your expansion and decreased workforce. This is the example of SWOT analysis in the hospital setup. Now there is a graph in which we shows these 4 parameters, and this graph name is SWOT strategy canvas. In the x-axis, there is a strength, opportunities, weakness, and threats are mentioned, and on the y-axis, there is the impact rate, which is from 0 to 0.5 and 1. This is low impact rate, 0.5 is medium impact, and 1 is the higher impact. SSC graph, SWOT strategy canvas graph track the impact rate of each element of SWOT, strength, weakness, opportunities, and threat. The goal is to witness a low impact rate of weakness and threat and a high impact rate of strength and opportunities. High impact rate basically is for strength and opportunities, and low impact rate is weakness and threat. The first line shows the weakness and strength and will take the color blue, and the second line on the graph is opportunities and threat, and it will take the color red. And you can also see in the graph these two colors. Basically, there are 7 rules for a good SWOT analysis. Be specific, avoid gray areas, vague description, or fuzzy definition. Be objective, ask for input from a well-informed but objective third party. Be realistic, use a down-to-earth perspective, especially as you evaluate strength and weakness. Be practical in judging both sections. Apply context. Distinguish between where the organization actually is today and where it could be in the future. Contrast and compare. Analyze realistically in relation to your competition, better than or worse than your competition. Short and simple. Avoid needless complexity and over analysis. Update your marketing plan and goals. Once the key issue have been identified, define the action step to achieve change. Now comes the uses of SWOT analysis. The first use of SWOT analysis is strategy building. SWOT analysis can be used to build organizational or personal strategies. Steps necessary to execute strategy-oriented analysis involve identification of internal and external factor, selection and evaluation of the most important factor, and identification of relation existing between internal and external features. And the second use is matching and converting. Matching is used to find competitive advantage by matching the strength to opportunities, and another tactic is to convert weakness or threat into strength or opportunities. And in the conversion energy is to find a new market. If the threat or weakness cannot be converted, a company should try to minimize or avoid them. Now comes the corporate planning. Development of strategies and plan to enable an organization to achieve its objective. That organization will use a systematic, rigorous process known as corporate planning. Setting objective. Define what the organization is going to do, environmental scanning, internal appraisal of the organization, and assessment of the present situation as well as a portfolio of products, services, and an analysis of product and service life cycle. Analysis of existing strategies. This should determine relevance from the result of an internal and external appraisal and may include gap analysis of environmental factors. Now comes the marketing management. Marketing management often finds it necessary to invest in research to collect the data required to perform accurate marketing analysis. Accordingly, management often conduct market research, alternatively marketing research to obtain this information. Marketers employ a variety of techniques to conduct market research. And some of the common example, qualitative marketing research such as a focus group, quantitative marketing research such as statistical survey, experimental techniques such as a test market, and observational techniques such as ethnographic on-site observation. The SWOT analysis has been used in community work as a tool to identify positive and negative factors within organization, communities, and the broader society that promote or inhibit successful implementation of social services and social change efforts. It is used as a preliminary resources, assessing strength, weakness, opportunities, and threats in a community served by a non-profit or community organization. Now it's time for the recent updates. This is one of the article, which is National Program for a Family Planning and Primary Healthcare Pakistan, a SWOT analysis. SWOT analysis was used by making resources to the structure and dynamic of the program as well as searching the literature. Strength of the program include comprehensive design of planning, implementation, and supervision mechanism added by MIS selection and recruitment process and evidence created through improving health impact indicators. Weakness identify are slow progress, poor integration of the program with health service at local level, including and demotivational factors such as job insecurity and non-payment of salaries in time. Opportunities include further widening the coverage of services, its potential contribution to health system research, and its use in areas other than health like women empowerment and poverty alleviation. Threats the program may face are political interference, lack of fund, social threats, and implication for professional malpractices. Strength of the program will necessitate a strong political commitment, sustained funding, and a just remuneration of this barefoot doctor of Pakistan, the lady health workers. The next article shows a synthesis on SWOT analysis of public sector healthcare knowledge management information system in Pakistan. In this article, basically describe healthcare is a community service sector and has delivering its services for the betterment of civic health since its established at common level. For working efficiency and effectively, this sector profoundly relies on correct and complete health information of people and proficient integrated healthcare knowledge management information system. The purpose and objective of this study was to determine and investigate the internal and external factors that influence the performance of healthcare management information system by performing SWOT analysis on two of the largest public sector healthcare organizations of Pakistan, The finding of this study will certainly help authorities to devise methods of improvement in Pakistani healthcare management information system, eventually paving ways towards a better and improved healthcare in the future. And the next article is strength, weakness, opportunities, and threat analysis of integrated the WHO patient safety curriculum into undergraduate medical education in Pakistan, a qualitative case study. The conclusion of this article, the theme of patient safety needs to be incorporated early into the formal education curriculum with the main goal of striving to do no harm and seeing mistake as opportunities to learn. Faculty development activeness needed to be organized and faculty members should to be encouraged to participate in them. The lack of patient safety culture was identified as the primary reason for resistance to this initiative at many levels. The WHO curriculum amended according to local institutional culture can be implemented appropriately with support from the corresponding regulatory bodies. Now it's time for the MCQs. SWOT analysis or SWOT matrix is a strategic planning and strategic management technique used to help a person or organization to identify various problems. Which of the following is correct description of SWOT analysis? SWOT analysis summarizes the opportunities and threat for an organization. SWOT analysis summarizes the key issue and the strategic capability of organization. SWOT analysis avoids the need for evaluating strategic capability. SWOT analysis is the substitute for environmental and industry analysis. SWOT analysis summarizes the strength and weakness of an organization.
A.
B is the right answer. SWOT analysis summarizes the key issues and strategic capabilities of organization. In first statement, only opportunities and threats are mentioned. And SWOT analysis identify the four things in which strength and weakness are also included. So B statement is correct. Step involved to execute health strategy oriented analysis for the identification of internal and external factor. Selection and evaluation of the most important factor. Which use of SWOT analysis depict in the statement? A is the right answer, strategy building. A is the right answer, strategy building. In SWOT analysis, we find competitive advantage by increasing the strength to opportunities, and another tactic is to convert weakness or threat into strength or opportunities. This use of SWOT analysis is known as marketing, converting, corporate planning, strategy building, or matching.
D.
No, it's matching. E is the right answer. In XYZ healthcare setup, there is development of strategies and plan to enable an organization to achieve its objective. That organization will use a systematic, rigorous process. This use of SWOT analysis is known as matching, converting, marketing, corporate planning, strategy building.
D.
Yes, D is the right answer, corporate planning. In health management information system, there is a new or innovative services, capabilities of producing cost advantages and extraordinary reputation. Which qualities are mentioned according to SWOT analysis? Strength, opportunities, threat, weakness, or capacities?
E.
A is the right answer. Strengths are mentioned in the statement. In health management information system, there is an absence of proper planning, damaged reputation, gaps in capabilities or service area, and lagging in technology. Which characteristics are mentioned according to SWOT analysis? Strength, opportunities, threat, weakness, capacities.
E.
D, weakness are mentioned in the statement. XYZ health sector is vacant by a competitor. Availability of new technology and lack of dominant competition. Which type of qualities are built for this health sector?
E.
B is the right answer. Opportunities in the statement. Like health sector is vacant by a competitor. No new vacant in the market. Availability of new technology and lack of dominant competition. So these are the opportunities for your organization. If your competitor has an innovative product or services and adverse changes in reimbursement or regulation according to SWOT analysis, which problems are facing? Strength, opportunities, threat, weakness, or capacities?
Weakness.
Yes, D is the right answer, weakness. SWOT strategy canvas is used in the analysis of how the health management information system work. Which rate is described in SWOT strategy canvas? Impact rate, decline rate, growth rate, track rate, failure rate.
Impact rate.
Yes, A is the right answer, impact rate. If the impact rate in SWOT strategy canvas is more than 0.5 and near to 1, which category of SWOT analysis falls in this rate? Opportunities and strength, weakness and threat, strength and weakness, threat and strength, opportunities and threat.
A.
Yes, A is the right answer, opportunities and strength, which is shown by a blue line in the SWOT strategy canvas. These are the key of my MCQs. This is the YouTube link of my presentation, and thank you.